Mr. Speaker, if the big, beautiful bill does add to the debt, will President Trump own that?
It's not going to add to the debt, but I can tell you that President Trump is laser focused on two primary things: delivering on his campaign promises and the America First agenda, which is what a record number of 77 million voters, popular votes, requested and demanded and gave us a mandate to do. But he's also concerned, as I am, as Ron Johnson is, as Rand Paul is, as all of us are, about the nation's debt. And he and I talk about this frequently, and he is excited about changing that trajectory. President Trump, I think, can be the most consequential president of the modern era because he has these opportunities to do these big things. The One Big Beautiful Bill is a big first step to provide relief for the American people, to give everybody more take-home pay, more money in their pocket, and to change the trajectory of the country. And again, it's the first of a number of steps, and President Trump is committed to doing this.
Mr. Speaker, so does the House bill put rural hospitals and, frankly, the most vulnerable Americans at risk?
No, and you can underscore what I'm about to tell you. There are no Medicaid cuts in the Big Beautiful Bill. We're not cutting Medicaid. What we're doing is strengthening the program. We're reducing fraud, waste, and abuse that is rampant in Medicaid to ensure that that program is essential for so many people, ensure that it's available for the most vulnerable. It's intended for young, single pregnant women and the disabled and the elderly. But what's happening right now is you have a lot of people, for example, young men, able-bodied workers who are on Medicaid. They're not working when they can. That drains resources from the people that need it most. And so what we're doing here is an important and frankly heroic thing to preserve the program so that it doesn't become insolvent. This is not going to hurt rural hospitals.
Bottom line, Mr. Speaker, you all had set a July 4th deadline to get all of this passed. Are you confident you can meet that July 4th deadline?
Yeah, they've always discounted us. I mean, I said I would do it out of the House before Memorial Day, and I was laughed at when I said that back early part of the year. But we beat it by 4 days, okay? We're going to get this done. The sooner the better, because all these extraordinary benefits that we're talking about have to happen as soon as possible. And I'm convinced that the Senate will do it, do the right thing, send it back to us. We're going to get it to the President's desk, and we're all going to have a glorious celebration on Independence Day by July 4th when he gets this signed into law.
What's wrong with that argument? Why shouldn't people have to go to work in order to get Medicaid?
Good morning again to you and your audience. Listen, I am a big advocate for work. I have a fierce work ethic. It was something passed on to me by my late father, who was a preacher and a junk man. And every day, he was picking up old junk cars to feed our family. And on Sunday morning, the man who picked up cars that have been thrown away picked up people who've been thrown away. And this is what this legislation does that they're trying to do. They're going to throw poor people away. I believe in work. And I recently released a study in Georgia that shows that this work reporting requirement, because that's what we're talking about, not work requirements, work reporting requirements is very good at kicking people off of their health care. It's not good at incentivizing work at all. There's something wrong-headed about this kind of view of poor people, of working class people, that somehow they don't want to go to work. We have seen this failed experiment in Georgia. We've got over 500,000 people in Georgia who are in the health care coverage gap. They are largely the working poor. The governor has put a program in place. He calls it Prosperity to Coverage. You ought to call it, or Pathways to Coverage. You ought to call it Pathways or Blockages to Coverage, because they've only enrolled about 7,000 people. That's pathetic. And the data clearly shows that if you want to get people to work, the way to do that is to provide them just basic health care so that they don't get sick. And what they're trying to do now is take this terrible experiment in Georgia, force it on the whole nation. And what we will see as a result of that is a workforce that is sicker and poorer and an economy that's weaker.
A direct answer to the question there, but we do need to keep moving because we've got.
Well, I take very seriously my job. The people of Georgia hired me to stand up for them, and this really is a critical week. Yeah. This big ugly bill is going to strip people of their health care. It's going to rob working class people of the resources that they need.
Yeah.
They're literally trying to take health care from children. Here's a proposal.
Yeah.
How about allow the tax cuts to expire for people making over $500,000 a year? If they did that, they wouldn't have to have these draconian SNAP cuts and cuts on health care.
All right.